Good afternoon. Thank you all for being here. We're joined today by our friends from NCH, who we've been working together for the last 2 years. Since the very beginning of this pandemic, we knew we would be stronger together, so we joined forces and shared protocols, shared experiences. We've even worked together to raise funds for our incredible staff. Before we go any further, I do want to recognize the chairman of our Lee Health Foundation, Payson Gaddis. Payson is here. The foundation has done incredible work over these past 2 years, helping out our staff, helping our people, as have the community. So it's hard to believe that it was 2 years ago on March 4th that right here in this ED we had our first patient with COVID. And we had no idea what the next 2 years would bring. During those early stages, we were filled with fear, uncertainties. We weren't sure how to treat the virus. We weren't sure the effect it would have on our staff. And yet their resiliency, their dedication, their commitment was unwavering. During that time, here at Lee Health, we've treated almost 28,000 patients with COVID. Truly remarkable. During that 734-day period of time, we've gone through millions of pieces of PPE, 2 million gowns, 2.5 million gloves, 240,000 surgical masks. And there's been a grassroots effort in the community too. 22,000 homemade masks were delivered to our staff members. A truly remarkable support. And while more than 26,000 patients have recovered from COVID, through today we've lost 1,416 patients to COVID. These are members of our community who've lost their lives and lost the battle. I want to just take a moment of silence and recognize them as we remember every single one of them. Thank you. There's been so much sickness related to COVID, but yet it's been inspiring to watch the resiliency of our staff every day when they face stresses that no one really could understand if you're not in the healthcare sector. But we've come together. We continue to show that same dedication and commitment every day as we still continue to treat patients with COVID. They're all heroes, and I'll never be able to thank them for what they've done. And I know the community feels the same way. I also want to thank the community for the unbelievable, unwavering support that we've seen. Our first responders, Fort Myers PD, Lee County Sheriffs, Lee County EMS, all have done so much to work with us. And the community has supported us with meals, with cards, with notes throughout this entire time. And I know it means so much for our staff. Lee Health and NCH Foundations work together to raise money in a Stronger Together campaign. That we did that for our staff, especially looking at personal protective equipment. And we also were able to purchase iPads to help family members connect with their patients and their family who were in the hospital when we couldn't have visitation. I want to thank everyone who's donated to Lee Health Foundation's Help Our Heroes campaign. Those funds went to help our Lee Health healthcare workers. If you'd like to support our healthcare heroes, you can find more information on www.leehealthfoundation.org, Help Our Heroes. We're so grateful for everyone's support. At this time, I'd like to introduce a true friend and a true partner, Mr. Paul Hiltz from NCH. Paul?
Thank you, Doctor. Good afternoon, everyone. I'm Paul Hiltz, the CEO of NCH, and it is my pleasure to be here and see Larry Antonucci. We were just reminiscing. It's been a long 2 years, but it's been a very short 2 years, and a lot has happened since that day in March. And over that time, we've treated thousands of patients successfully, but we too lost a number of patients to COVID. We lost 377 people due to COVID, so I'd like to just take a moment of silence to remember their lives. Thank you. So a lot has changed and a lot has stayed the same, but we maybe shake hands a little bit less often than we used to. Sanitizer flowed like water throughout the last 2 years, but one thing has remained the same, and that's the excellent care that both Lee Health and NCH have provided to our communities. And Larry, I think you're right. We were stronger together in working through this. Over those past 2 years, our 2 health systems have stayed open and safe. We've never run out of the vital supplies or personnel to take care of our communities. And I know, Larry, you and I are both very proud about that. And the work that our teams have done has been truly remarkable, and I can't express enough gratitude for the sacrifices that these people made, including the first responders, nurses, physicians, clinicians, techs, up and down the line. And so we thank all of our healthcare heroes here in Southwest Florida and really across the country. I'd also like to give my heartfelt thanks to our community for their support, including donations of food, PPE, and financial contributions to help our staff stay safe and resilient. With our community support, we received enough donations to purchase 7 of the Light Strike Xenex robots that killed COVID-19 in between patient rooms. And with our community support, we were able to, as I said earlier, provide PPE, gowns, respirators, everything we needed to take care of this. And in Naples, we had over 50,000 free meals delivered to our caregivers during the pandemic, something that really talks to the generosity of Southwest Florida. Over 5,000 turkeys were donated, hundreds of dollars worth of gift cards, all of this over this past 2 years to recognize the sacrifices of our frontline caregivers. And as I look back over these 2 years, like you, Larry, you have to feel incredibly proud to be part of a great organization like a Lee Health or like an NCH. We stand with our colleagues and really just give great thanks to people like this for doing a fantastic job. During the pandemic, too, our 2 organizations continue to rack up accolades for the overall quality of care. And at NCH, we're particularly proud that we were able to get 2 Leapfrog A's and be named a top 100 hospital in America, and we're really, really proud of that. So I'll just close by again thanking all those who sacrificed so much over these past 2 years. And Larry, thank you so much for being willing to take my many calls during the last 2 years and looking for advice and ways we could collaborate to deliver fantastic care in Southwest Florida. It's been a great privilege. Thank you.
Thank you. Wow, I can't believe that it's been 2 years already. It's amazing to think that it's been that long. I remember like it was yesterday that I was taking care of my first COVID-19 patient. It was a woman. She was in her 40s. She was a mom. She was a wife. She was a daughter. She was a sister. She was a brave member of this community. She was somebody's somebody. She was somebody's everything. And they were counting on me, on us, to make her better and to bring her back home. I'd be lying if I said I wasn't scared. We were all scared. We were scared for ourselves, for each other, for her, for our families. I quickly realized that I couldn't go back home and just read the textbook like I had previously, because in this situation, the textbook hadn't even been written yet. Then, the onslaught began. We as healthcare workers felt a barrage of patient after patient, bringing us to the brink of maximum stress, anxiety, depression, making us process all of these moments and emotions within minutes of each other as we moved from room to room, putting patients on life support and watching others die right before our eyes. Wave after insurmountable wave. Chances are you or someone you know got the bad version of the disease. We as healthcare workers, we only saw the bad version. The one that took away our community members, our kids, our moms, our dads, our grandparents, and our families. It was our job to bring them home, and we took that responsibility wholeheartedly. Unfortunately, there were times where we failed, and we didn't bring them home to you. But in those moments, we made sure that they felt loved by holding their hands, playing their favorite music, comforting them, and FaceTiming you as they passed away in front of our eyes. For For the ones that didn't make it home to you, I am personally sorry for your loss. A COVID-19 patient once told me that doctors, nurses, respiratory therapists, advanced providers, CNAs, physical and occupational therapists, speech-language pathologists, dietitian, emergency room techs, and even our beloved lunch ladies. These healthcare workers are the watchers of creation, sent by God on a mission to watch over humanity. I am so proud to have worked next to these brave men and women. We healthcare workers, along with our partners at Lee Health and NCH, we promise to continue to watch over our community for the rest of this pandemic and illnesses to come. Thank you.
Good afternoon. My name is Ilya Echeverria, Chief Nursing Officer at NCH Healthcare System. As you have heard, our community has been living with COVID variants forms for quite some time. While we know that variants are expected in viruses, I'm happy to report that for the first time in a long time, there are no variants of concern on the horizon that we are aware of at this moment. The virus has changed our world forever, but today there is a brighter light at the end of the tunnel, as we're in a much different place today compared to where we were even a year ago. Throughout the pandemic, we've seen science mobilize quickly to learn about the virus, understand it, and develop treatment options. Physicians from once competing healthcare systems working together in tandem and sharing information to support and heal communities. Antivirals have made their ways into the market now as one of the newest weapons in the fight against COVID. And today, just barely more than 1 year since they became a reality, vaccines are easily accessible, they are safe, and a proven method to evade COVID or at least minimize its symptoms. 66% of individuals in the state of Florida are now considered fully vaccinated. While this number is good, we continue to encourage the 34% of our population who remain vulnerable to safeguard themselves for the community as a whole. With the number of COVID cases minimizing and the feel of a much needed break from COVID, we should now focus on taking care of ourselves in other ways than just avoiding coronavirus. We encourage viewers to seek the necessary preventative care needed that in many cases may have been postponed due to COVID and possibly long overdue. These include things such as physicals and breast screenings, lung screenings, colonoscopies. We've learned so much in such a short amount of time, and we continue to learn more. As the director of the NCH COVID response team and a nurse myself, I've witnessed firsthand our caregivers in the trenches treating patients and seen every emotion, from the joy of a recovery to frustration to helplessness and sadness for a loss. Not many outside of the healthcare field know the weight of those emotions on our caregivers and the toll that it has taken on all of us. But it is the promise of new treatments and antivirals, coupled with our community's continued commitment to safeguard themselves, families, neighbors, through vaccination and preventative efforts that will help us all prevail. This is not the first pandemic to plague humanity, and it certainly will not be the last. However, with the numbers of those infected with the latest Omicron variant surge quickly subsiding, the numbers of those getting vaccinated slowly creeping higher, and the advancement of new and novel treatment modalities to prevent, minimize, or treat the damaging effects caused by COVID, we can all breathe just a little easier with the optimism that this second anniversary of the pandemic will find us all in a more hopeful place than we were just a short while ago. Thank you for your time today.
Thank you, Ilya. I hope you can get a sense from today the incredible pride, gratitude that Paul and I feel for the staffs and those that have been working so hard during these past 2 years, many of whom are here today and here with us. It truly is remarkable, and words really can't express it. We do the best we can, but it really is an amazing thing to see as we go through this every day. As we move forward, it's time to begin to normalize. As we see these COVID numbers come down, our incredible incident management team has been working overtime for these 2 years, helping us through the pandemic. And now as we see the numbers, we know that we are not as high a risk as we were in the past, but we need to make sure that if you're not vaccinated, you're up to date with your booster systems. And we will be here. NCH and Lee Health will be here if there is another surge, whether it's from COVID or any other healthcare issue. We've been here through the past, we'll be here in the future. So again, I want to thank you for being here today as we commemorate this somber anniversary. Thank you.